So we are discussing about observation. When the person come inside, how that person is walking, how that person is showing uh, their different gates. So we will see that video first. After that, we will start today's discussion. So I have to share my video. You guys can see my screen, right? Are you able to see my screen?
Yes.
Yes, sir.
Yes, I can see it.
Same time. Same time. Right now.
So this is a hemiplegic gait. Whenever somebody having suffering from paralysis and the center is in the hemiplegia, the one side of the brain. So in that side, if the person is walking like this, we can easily identify that there is a lesions in the brain.
Kaya ka tubig. Kaya pa doon.
Please mute everyone so everyone can listen this video.
Mhm.
So these are the gates where we observe the patient and we can easily identify that the particular lesions, the area, affected area. You guys can listen me. So
Sir, there was no volume in the video, sir, when you played. Was it supposed to be like that?
No, the voice is clear here. You guys
Sir,
didn't.
your voice is clear, sir. But the जो वीडियो में है ना बिल्कुल आवाज नहीं आ रही थी सर 1% भी
Okay, I will
जो अपना
explain you later. So we will continue after that. So, okay. So these are few gates. These are explained in this video. I will send this video to you guys. You can see at home. Okay. So next portion we are discussing about the physician's role in observation. We are discussing about this, and this is aphorism number 90 footnote. So how the patient behave during the visit. How the patient behave during the visit. When the person come inside, we check the gate. Different types of gates are there. We already seen in that video. We shake the hand. After shaking the hand, we can know about the quality of the hand. It is soft, rough, cold, hot. Okay. The quality of the nails. And last time I discussed about the arsenic album. When there is a transverse ridge on the nails, these are the keynote of arsenic album. Then atmosphere, the patient's atmosphere, how he or she react while sitting in the room. Any order, attitude of the patient, as we seen like Parkinson disease, how the patient walk, how the patient show the attitude. Then the dressing sense. Patients come with the exact, absolutely clean dress, all creases in the point, and some comes with the. We are discussing aphorism number 90 footnote. Dressing, neatness, cleanness, color, expression, expressive or casual, traditional or unorthodox. Body language, when the person is explaining their symptoms. Now, the person who is sitting in front of us, the way of speaking. In the morning, 6 o'clock, I had just seen one case having a right axis deviations of the heart. And that patient called me from India and says, "Doctor, do something for me." I says, "There are lots of doctors out there and you can consult them." He said, "Doctor, I can take the medicine, doctor, but I cannot believe anyone. I cannot believe anyone." Because he was known to me and he know the way I'm working. But there are lots of homeopaths there. I can take the medicine. I can visit them. But how I believe on them, they are correct or not correct. They are good or bad. If something happened, what will be the results? The tone, because he want medicine only from if faithful persons. Any personality which he doesn't know about them, he will not go there. Never. He cannot believe. He cannot take any medicines. So he was suffer a lot but he did not take any medicine from anyone. So the tone of the voice and method of expression. So if I say tone of the voice and the method of expression, we cannot understand these things until and unless the patient sit in front of us and we have some experience with them, or we know the body language of the patient, how he sit. Some patients like come and sit like this, and some patient very curiously and sitting always close to you, always. And sometimes they use the gestures after explaining their symptoms. So first question, that does he speak in a demanding manner? Doctor, do something for me. I'm suffering a lot. Do something. Give some medicine. Suggest any doctor so I can take medicine or get relief. Demanding. He want anything. Sometimes very friendly manner. Oh, doctor, I'm suffering from this, man. You know about me. You know about me. Give some medicine. Friendly manner. Shy manner. You can see all these things in the small kids. Exaggerated. The small, he has a small complaint, but his expression feel like that there is a lot, it's an immediate emergency. But the condition was not that much serious. Witty, inappropriate, expressive, introverted, or any other. So this is our duty to observe these things. When we know the exact meaning of witty, when we know the exact meaning of shyness, friendly manner, demanding manner, the way the person is talking, we can understand what the person needs. Second thing is the person is drowsy or dull. And third thing, how is the vivacity and energy of his expression and the eyes? Sometimes the words doesn't match with the expression of the face. And if doesn't match with the expression of the face, then affectation is one of the rubric where person showing something else and he's speaking something else. Affectation. One is affection and one is affectation, when the person is only demanding extra care. He doesn't have that much problem. Then the mood of the patient, both in himself and in relation with the doctor. Depressed, worried, anxious, afraid, frightened, suspicious, secretive, ashamed, shy, silent, irritable, indifferent. So, doctor, I have this problem from last 2 months. And did you visit anywhere? No, doctor, I didn't visit anywhere. Why you come today? I know, doctor, I have a problem. My wife says, you have this problem, you have to visit the doctor. So I come, give some medicine. One side, he know that he has a problem. This is indifference. He know that he has a problem. But he didn't take any action. Any action. Somebody says, oh, you have to go to doctor. So he says, I come here. This is frivolous. The way the person is talk, suspicious, comes to you, doctor, I have a wart in my neck. Very, always close to you. I have a wart here. Can you check? Secretive. He will not express himself loudly. Always doctor and the patient, nobody in between. Then when they realize that that person is trustable and I can explain what I have, depressed, worried, frightened. I have one patient and he was fall down from the scooter and he has an injury on the foot, and on injury of the foot, two pins like in wound are there, two pin like. When he reach home, his wife says, "Oh, I think this is like a snake bite." He was frightened. And he called almost 12, 15 doctors and show and send the picture of that injury. And he know that he was fallen from the scooter and there was no snake over there. And he sent the picture to me too. And showing doctors, see, look at this. What is this? And I asked the question, why and what happened? I was fallen from the scooter, and after that, I have that injury. And he calling after half an hour of that injury. Frightened. There is a big difference between fear and frightened. And who know the who are in our repertory session, they know that the difference between frightened and fear. Big difference. Sudden fright. Ashamed. Silent. Then general configurations. The complexion of the case, the patient, the skin, the nutrition. Is there any deficiency, any emaciations? And stature. Long, short, medium, different type of skin colorations, everything. Then study of the facial appearance. Facial appearance. I will show you something. So look at this. This is plethoric. You can see redness here, redness here, redness here. And in normal condition, the face almost always red. Redness. This is called plethora. Plethoric face. And facial plethora referred to reddish complexions of the face, often accompanied by swollen or puffy appearance. Puffy appearance. Then you can see here waxy face. Mostly the person who suffer from kidney disease, if you can see their face, abdomen, they are look like waxy. Sometimes this is just an example. Sometimes the patients come to you and he or she sit in front of you and you will see his face is shining, shine like she put lots of oil on the face, shining, oily face. And waxy face can refer to either oily skin or a specific skin condition, both of which can be related to the sebum productions. Oily skin is characterized by an excess of sebum, the oily or waxy substance that moisturize and protect the skin. Second, just the face. When we look the face, we have to understand the quality of the face. Then, pale face, paleness. Look at the lips and the eyes. Paleness. And paleness refer to skin condition where the face appear lighter than usual, often due to reduced blood flow or lower red blood cell count. So this is a puffy face. Look at this, the swelling here. This is a puffy face. And this is temporarily. Mostly the person who sleep a lot, after that, their eyes are swollen eyes, and you feel that the person sleep a lot. He was sleeping. Now, this is temporary. This is a non-specific, mild swelling or bloating of the face, often due to that temporary cause. Causation is temporary. It may be a lack of sleep, allergy, crying, dehydration, water retention, high salt intake, menstrual cycle or hormonal change, or alcohol consumption. These are the reasons. Puffy face. And so this is odiomatous face. Odema. This is called odema. There are lots of swelling of the face. Everywhere you will see the retentions of the fluid. Puffy face. So edema, clinical condition, accumulations of the excess fluid in the facial tissue leading to persistent swelling. These swelling are not reduced automatically. This is almost permanently, and it is in kidney disease, heart failure, hypothyroidism, allergic conditions, medication like steroids, calcium channel blockers, infection, and superior vena cava syndrome. They are some reasons. This is myxoedema phase. First sign, the hair dry, coarse, and sparse. Lateral eyebrow thin. The lateral part of the eyebrow become thin. Periorbital edema. The lower portion of the eye is having edema. And puffy dullness face with dry skin. Dry skin. So Myxedema phase refer to a facial changes that can occur in individual with hypothyroidism, particularly in severe and advanced cases. These changes are characterized by puffiness, swelling, especially around the eyes, and the swollen tongue. And this is lupoid phase. Look at this. And this is the same quality, butterfly-like redness you can see in both sides. And are you guys remember any medicine having this type of redness on the face? Anyone?
सर एपिस मेलिफिका
No.
Sepia.
Sepia. That's sepia having this type of facial redness or discoloration. And one remedy is colophyllum. Colophyllum having this type of discolorations. So this is a redness. This is lupoid phase. Face lupoid is sometimes used to describe the characteristic butterfly-shaped rashes that can appear on the face in people with lupus, especially acute cutaneous lupus erythematosus. This rash, also known as mallow rash or butterfly rash, typically appear on the cheek and the bridge of the nose, resembling to butterfly wing. So all these things, we can see all these things. We can observe all these things. So first, plethoric, waxy face, pale face, puffy face, oedematous face, myxodemus face, lipoid, mangloid, etc. When we see these things, we have also, on the other hand, we have to note that the patient is affectionate. The way the person is talking, affectionate. Second, angry, cunning, stupid, shy. Small kids, the way they are expressing themselves, we can easily differentiate. Then, if we go somewhere, some house, somebody house to see the patient, and the patient is in bedridden, the first thing which we see in that kind of patient is decubitus. Decubitus, I will show you that. So, decubitus. So one is mangloid. Mangloid. Mangloid eyes. Look at this. I just want to show the exact. So we can differentiate mangloid eyes with the normal eyes. So double lid, and in mangloid, monolids is a single one. Double lid and single, and mostly this is the phase of Down syndrome. And we can easily identify this phase. So these are decubitus. These are decubitus. Mostly the bedridden patients. These are they have this type of ulcers. Decubitus referred to position of laying down and is most commonly associated with decubitus ulcer or pressure ulcers or bad sore. Whatever the condition of the patient, we have to manage these things first, because if it is increased, it worse the condition of the patient. Then the room is lightened, dim or dark. The patient was laying down. He was preferring the light, dim light or absolutely dark. Second thing, which we can observe this, just observe. Third thing, environment of the room. Fan, air condition, cooler, heater, switch on according to the season, window, doors is open or closed. It's depend on environment or season. And is the patient and his surrounding tidy or untidy? And the way the patient welcoming the physician is very, very important. These are just observation. And any visible eruptions, warts, fingers, nails, and sweat, imperfections of the teeth. So we can note down all these things. Then, what not to do in case perceiving? We see everything. We discuss the observation, just you and the patient, and you are not asking a single questions to the patient. We just observe the case. Next, what not to do in case perceiving. When taking the test, what we are not doing in that case is never write any complaint in your own language. Don't write anything in your own language. As the patient says in any type of language, always in the language of patient. What the patient is saying to you, you have to write it down as it is. This is instruction of Hahnemann. Second, never interrupt patient when he or she is speaking. Never interrupt. Don't interrupt. Wait. That's why Dr. Hahnemann says patience, the homeopathic physician should have enough patience to listen the patient. Avoid cautioning along the line of the remedy. That person is affectionate. Do you feel chill when you have pain? We are suggesting. And if the patient having this problem, he definitely tell you. And never ask direct question. Are you thirsty? Are you irritable? And do you have pain in the stomach? If somebody having a stomach pain, he definitely explain his condition, because whatever is important according to the patient, if he has a abdominal pain and he tell you, doctor, I didn't pass a stool from last 5 days, and he has a pain now, what is important? Pain is important, or the constipation is important, where the patient is telling you guys, I didn't pass the stool from last 5 days. Find out the cause. Causation is much more important, and he give you a evident cause. And the next question was, you didn't have any urge to go to stool? No, doctor. I don't have any urge to go to store. I don't feel anything. But suddenly when I wake up in the morning, I have abdominal pain. Still, I don't have any feeling to go to store. This is very strange. Very strange. So we have to focus over there. Never interrupt. Suggestive questions we have to avoid. You do not stand with cold very well, do you? If for example, in Canada, the temperature lower down up to minus 35, 40, and in that condition, if you ask, do you feel cold? This is stupid questions. But in minus 35, if he was in half sleeve and in short and slipper in the feet, you will definitely astonish from this look. I have seen one person, minus 35-degree temperature, and he was in half sleeve and in shorts. And when I ask him, you do not feel any cold? No, doctor. I am from last 20 years. I'm staying like this. I never feel cold. Minus 35, where the person having he can freeze himself in minus 35. He doesn't have any problem. He's just walking here and there. This is strange. This is what Dr. Hahnemann says in aphorism number 153. Characteristic, very peculiar, strange symptoms. And this is very different, absolutely different, absolutely characteristic. You cannot leave these symptoms because this is the characteristic of that patient. Doesn't matter he has any type of problem, he has a cancer, he has anything. If he has this type of strange thing, you have to note it down. And questions where the patient choose, do you prefer dry or cold weather? Do you dream about sad or cheer things? And mostly we ask this, but Dr. Hahnemann says, avoid to ask these questions. Avoid to ask this. And the fifth one, do not rush the patient in a quick answer. Do not. Quick answer is always apt to be wrong and default the entire process of case taking. Don't jump into conclusions on the basis of only few symptoms. And never take it for granted that you know the case before you have wholly taken the case. And most of if we see the social media, if somebody says, oh, doctor, I have a fever, can you suggest me any medicine? And doctors give this, Aconite, belladonna, this or that. They are just suggesting them and without knowing anything. We have to avoid. And never substitute the conjecture of actual observation. If you observe the patient, if you know that what you observing is different, what you observing is exactly present there, note it down. Believe in your observation. And Dr. Perry Smith, he wrote it down in his book. He said, what your brain knows, your eyes is only seeing that condition. And if your brain doesn't know anything, your eyes will never see. Never, you cannot see that thing. Then is our duty now. So, what is the active role of physician during interrogation? Now we are going to start speak. Active role. Active role started from aphorism number 85.
85.
Active role. This is now our active role. What Hahnemann says in 84, he began a fresh line with every new circumstances mentioned by the friends or his friend, his mentioned by patient or his friends, so that the symptoms shall be all ranged separately, one below the others, and he can thus add to any one that may it first have been related to in two way in manner, but subsequently more explicitly explained. So we have to complete the whole symptom. It should be present location, sensation, modalities, concomitants with its durations. With its duration, and you can see everything in aphorism number 85 and next is 86. When the narrator have finished what they would say to their own record, the physician then revert to each particular symptoms, elicit more precise information respecting it in the following manner. So we have to complete the case. One person is come to you and says, Doctor, I have a headache. I have a headache, doctor. I feel like there are lots of hammer knocking in my brain. So you have two things. One general symptom, he has a headache. What he sensation? Sensation is hammer-like sensation. And he has a pain, doctor, pain, pulsating pain. Sensation like hammer knocking in the brain. This is sensation. And what kind of pain? Pulsating pain. Doctor, whenever I have a headache, always is into the left side. Always in the left side. I never feel any headache in the right side. Never. Always in the left side. And after that, left side, doctor, whenever I have a headache, vomiting started. So there is no connection between headache and vomiting. So vomiting is a concomitant symptom. This is concomitant. Whenever I have a headache, this is sure that I will have a vomiting. And whenever I vomit out, I feel better. This gives modalities. Now, the general condition, we complete that whole symptom. Now it becomes peculiar. If you read headache from practice of medicine, you will not find these symptoms. And whatever written into the practice of medicine, whatever you got different from practice of medicine, these all symptoms are peculiar, very peculiar. That's why we have to read practice of medicine, because practice of medicine give you pathogenomic symptoms and we need characteristic symptoms. That's why Dr. Bonninghausen gave us location, sensation, modalities, concomitants. So we complete the case. And If you read 153, aphorism number 153, just open it. Just open 153. Last 5 lines. The more general and undefined symptoms, loss of appetite, headache, debility, restless, sleep, discomfort, and so forth, demand but very little attention. If somebody give you these symptoms, these are less valued symptoms, very less valued symptoms. Then, but when of what when of that vague and indefinite character, when there is indefinite character, if they cannot be more accurately described, until and unless they are more accurately described, they are useless. We cannot take all these symptoms into consideration until they are accurately described. A symptom of such a general nature are observed in almost every disease and from almost every drug. Improving. Almost every drug produces headache. But if I say natremure, everyone having a characteristic of natremure. Headache, pulsating pain, sensation as if thousands of hammer knocking in the brain. This is sensation of natremure. And one patient comes, doctor, lots of my headache was very intense, but when I pass large amount of urine, I feel better. I feel better. So, general to peculiarities, until we have very peculiar nature of symptoms, we can easily prescribe the medicines. But if you have only general symptoms, we cannot prescribe anything. So come back to 86. So Hahnemann gave few examples in 86. For example, at what period did these symptoms occur? It means timing. It's morning, afternoon, evening, night, midnight, after midnight, early morning. When? Then have a particular time. And we have lots of remedy having a particular time. 11 o'clock, sulfur natriureticum. 4 to 8 p.m., lycopodium. After midnight, arsenic. Before midnight, sepia. 3 o'clock, calicarb. Early morning, naxomica. Very peculiar timing. And timing is very, very important. Very important. And one patient comes to us and he says, doctor, my son having a bedwetting. Whenever he sleep, after half an hour, he passes the urine. One condition is that. Second condition, doctor, he always passes the urine after 12. So we have to understand the sleep pattern. Superficial sleep, deep sleep. Mostly the patient what we got having a superficial, and the remedy is creosotum. When the person pass out the urine before 12 o'clock, creosotum, bedwettings. So at what period did these symptoms occur? Timing. Was it previous to taking the medicine he has hitherto been using? So that's why in aphorism number 208, Dr. Hahnemann says, no, not 208, it's 207. 207 and aphorism number 91. When one patient is coming from homeopathic hand and when one person is coming from allopathic hand. Dr. Hahnemann says in 207 aphorisms that when the above information has been gained, it still remains the homeopathic physician to ascertain what kind of allopathic treatment had up to that date been adapted for the chronic disease, what kind of allopathic treatment he was taking. And then we ask, is it this condition present before that medicine taking or after that? So we differentiate. If it is comes after the medicine, then we have to stop that medicine. When we stop that medicine, in few days, 5-6 days, you will get the results. Is that condition improved? If it is improved, this is the bad effect of that medicine. We have to eradicate. We have to remove that medicines. And second, when the patient comes from homeopathic, when the person comes from homeopathic, he never give you a perfect picture of the case. So we have to give non-medicinal substance for few days or suggest him to take a cup of coffee for 2 or 3 days. So I just want to say one case because this case was very different because I have already told this case. I have small girl of 9-10 year old and she has lots of eruption of the whole head, whole ears, whole head having a big eruptions and bleeding from ears and the whole face was having lots of wound. And that patient was taking homeopathic medicine from last 3 years and she taken almost 50 remedies every day. And that case was improved in 3 days after just giving a 2 cup of coffee. Just 2 cup of coffee and the whole symptoms was all eruptions, all bleeding, all pus gone in 3 days. And I gave my first prescription after 6 months, only 1 dose of Sorinum. And only for one symptoms, very offensive. Just for offensiveness. All eruptions are gone, but offensiveness doesn't go. Offensiveness. So when all symptoms are removed, everything was gone, you have to take the case again. And when the symptom is lingering with the patient, that patient is belong to pure picture of that patient. Pure picture. Pure symptoms. And this is totally soric. She already taken sulfur long time before, many times. So I jump into the second level. If you read Sorinum is a chronic of sulfur. If sulfur fail to heal, we can use Sorinum. So I prescribe Sorinum and it's almost 10 years gone. No eruptions. Everything is absolutely okay. So while taking the medicine. So we have to ask these symptoms before the medicine taking, after the medicine taking, or during the medicine taking. And only some day after leaving of the medicine. And if you leave that medicine, did you get all these symptoms back? And what kind of pain, what sensation exactly was it that occurred in that spot? Where was the precise spot? Did so location and sensations come? Did this pain occur in fits or by itself? And at various time. One is intermittent fever, intermittent pains. Intermittent pain is when pain started, goes to peak, come down, absolutely no pain, then pain start, peak, then goes down, then there is a period when there is no pain. This is called intermittent pain. So was it is continue without intermission? When continue fever, continue pain, there is no reductions of the fever or anything else. How long did it last? If you have this pain, how much time it will remain in the body? And one thing more, one person comes to you and says, Doctor, I have a pain, and that pain, I am suffering from this pain from last 1 month. And first time that pain started 1 month ago, and that pain remained for 4 hours. And after that, somebody told me to give a anti painkiller, and I took the painkiller. After that, the pain goes down. Now, whenever I feel that I have the pain, I take the medicine before the pain. This is very, very peculiar condition of the. This is called cautious. If you driving on the road, you will see two type of sign. One is cautious and one is careful. Careful. When we are on the bridge, we have to careful about on the bridge. Cautious before entering the bridge. Be cautious. The road is slippery ahead. Careful. Road is slippery. So we are careful. When something we cautious before the storm comes, what we do before the condition come, this is called cautious. Very, very peculiar, very, very characteristic symptom of the patient. Doctor, when I feel that I will suffer from pain, I will take the medicine. Or one condition that I already told before is prodrome. Prodrome. And prodrome is the condition where the fever will start in the evening, the sensations of before the fever, burning in the nose, heaviness of the eyes, tiredness of the body, these all come into prodromes before actual condition will start. Then at what time of day or night, in what position of the body it goes worse or entirely ceased? What is the exact nature? What is the exact nature this or that event or circumstances mentioned, described in a plain word. This is what Dr. Hahnemann says to complete the picture. And second is history of onset and moment of the disease. This is now is in 93 and 94. Aphorism number 93 and 94. So if the disease has been brought on a short time, or in the case of chronic affections, a considerable time previously by some obvious cause, then the patient or his friend, when questions privately, will mention it either spontaneously or when carefully interrogated. When you ask your patient how it started, is it acute and chronic, you can easily differentiate these cases. But the footnote of this aphorism is very, very important. Every person, every physician who listening me, you should remember this. This footnote is very valuable while case taking. Any cause of disgraceful character, any causation. Doctor, I was in the meeting yesterday, and my boss, he was shouting on me in front of everyone, and I feel very ashamed, very, very embarrassed that I cannot explain. If you see my facial expression, you can see what is inside that patient. Doctor, I just want to say something, I just want to reply him, but I cannot because he was my boss. That person is attached inside. Disgraceful character. What is inside that person? We have to judge. We have to see the depth of that disturbance. Because of that person, because of that cause, the patient comes to you, which the patient or his friends do not like to confess. Sometimes the situation is like, doctor, I didn't say anyone about this condition. I face this condition. Sometimes female small kids, small girl, daughters, small girls, kids or boys, they never say anything. A few days before, I have read one condition, one small girls, and the parents are working, and they leave that small girl in neighbor's house, and there was a 60-year-old maid, and he was abusing that girl, small 6 7 year old girl, and she didn't says anything. When she asking, when she become she suffer from some disease, after that they realize that she faced this condition, she faced these situations. So many things we have to find out. So not like to confess, at least not voluntarily. They didn't say anything voluntarily. And the physician must endeavor to elicit by skillful framing his questions or by private information. So this is our duty to find out what is behind it. Asking privately, so, asking you, manage your question so she can believe on you and she can tell you the whole story. And to these belong poisoning or attempted suicide. These are few situations where person will not tell you directly. Onanisms, indulgence in ordinary or unnatural debaucheries, excess in the wine. So unnatural debauchery. Sometimes the patient having, for example, I tell you one more story. I got one case from England. That person having very, very bad habits, very bad habits. He was indulged with gay societies, male societies, or uh, very obnoxious, we can say that, very bad society, and he was trying to make video of himself. And after that, he suffered from gonorrhea, and doctors identify gonorrhea in the throat and in rectal region. When I take the case, I was fully shocked. Even my brain was still having the memory of that condition, because his wife called me and she told me the whole story. Even she know after 1.5 year after, when she suddenly see the video of that person. So this aphorism written in 250 years before, and still this is correct, absolutely true today. Even these are where we have to focus. We have to focus to get the exact situation of that person, exact condition, why that person suffer from this condition. Ask these questions yourself and you will get the answer of. So excess of wine, cordials, punch, or other ardent beverage, coffee, or indulgence in eating generally, or in some particular food of a hurtful character. Yesterday, I have some person, and she said, "Doctor, she eat those things which disturb the health of her." One patient having a abdominal complaint, and she was in hostel, and she suffered from that condition because she has to eat that food and she is taking. And one person comes to you and, "Doctor, my husband or my wife is 60-year-old, and whenever she eat or he eat curd, he has a abdominal complaint." And the question is, then why you eat? "Oh, doctor, this is the habit. I cannot leave this. Whenever I see the curd, my internal feeling that I have to eat it, and I eat it, and after eating, I have this problem." This is called childish behavior. You don't go with the physical nature of the patient. Childish behavior. He know that that condition is the food material is his hurtful. He suffer from some complaint after eating this, and still he is, because of the habit he is taking it. And whenever he's taking it, he suffer from abdominal complaint. But he didn't leave that condition. Childish behavior. Then infection with venereal disease, or its unfortunate love, jealousy, domestic infelicity, worry, grief on account of some family misfortunate ill usage, but revenge, injured pride, embarrassment, or of a pecuniary nature, superstitious fear. Doctor, last time somebody, I have heard into the YouTube that if somebody is in a house is get sick, you have to stay away from him. If he is sick, everyone is sick. No, doctor, from that day I cannot stay in that room. I never go in that room. I didn't touch any particular any object in the room. Never. If I touch, I will become sick. Superstitious. Superstitious fear. And hunger or imperfections in private part. Rupture, prolapse, so forth. Case taking, important. After that, differentiating acute, chronic, or acute exacerbations of the chronic. Differentiate, narrow down, ask the question why that person becomes sick, what kind of situation, physical or mental level. And if you see aphorism number 16, footnote of aphorism number 16, most severe diseases may be produced by sufficient disturbance of the vital force through imaginations and also cured by the same manner. Doctor, I have seen that the person, the male guy, he was abusing that girl. I was standing there, and after that, I get so much afraid to every male, even my father. He just seen, and after that, she imagined, and she suffered from that conditions. And if you see introduction, page number 15, line 10th line. But what need is there of all this proof? How often has it happened that an irritating word has brought on a dangerous bilious fever? Doctor, my son went to the school, and after that, his teacher, he scolded on his work, and after that, when he came back from the school, he becomes sick. Now he has a fever. And so many times when the father go away from the house, the small kids having a fever. So many times. You will see so many times. And after that, a superstitious predictions of death has caused the fatal catastrophe at that every time announced. The abrupt communications of sad or excessive joyful news has occasioned sudden death. If somebody have $1 million lottery and he die at the same time, and you heard so many news about like this. And where is the material morphic principle that enter into the substance, into the body, there to produce and keep up the disease, and without the material explosions and in ejections of which a radical cure were possible? A single word. That's why case taking is more laborious job. Then it's almost 1.5 hours gone, and Dr. Corbin almost sleepy. So we will we will stop here. Any questions you have? Any questions? So we will discuss the next 94 aphorism tomorrow, next week. Until and unless you have to read aphorism number 85, 86, 93, and 94. And any questions you have now? Anyone? So that's all about today's session, and we will discuss next sessions. Thank you so much.